If you're a nurse practitioner, I want you to go ahead and stop scrolling right now, or thinking about becoming a nurse practitioner, go ahead and stop scrolling now and watch this video before you do. I'm Gigi. I'm a nurse practitioner, been a nurse practitioner for the past 3 years, and these are things that I wish I knew prior to becoming a nurse practitioner and or starting my career as a nurse practitioner. Okay, so basically the first thing that you're going to do as a nurse practitioner prior to getting any sort of job is to review that contract with a contract lawyer. Okay, so as far as new nurse practitioners, a lot of times they, are just happy to get a new job. And that's true because it's really hard to secure that first job as a nurse practitioner. But when you see that contract, you need to look at it with a contract lawyer and or someone who has a lot of experience with these contracts so that you can know how to negotiate a really good contract. Okay, so the contract is there to basically safeguard you as well as safeguard the company that you're working with, right? So, and it also serves as something that will protect you in the event that, say for instance, something changes, right, that you didn't agree to in your contract. You can always go back to the contract, say, hey, this is not in my contract, right? You can negotiate the contract as far as money. What are they paying people in this area? Well, how much experience do you have? So you can negotiate the money. You can negotiate whether or not you'll work weekends. You can negotiate as far as there's something in some contracts called something majora. I don't want to say the first word because I can be wrong, but basically it says like in the event of like a natural disaster or something like that, or say for instance in the event of like COVID, something like that, they can basically terminate you within like 24-hour period or something like that time frame. A lot of people look over that. So you can even negotiate that like, hey, I need longer than that. I might need 3 months. So, I can find another job in the event that, that occurs. So these are things that really need to be looked at, and you like with a fine eye. Is a legal document. It's something that you're signing. It's something that they're signing. So you really need to be careful because a lot of people get effed over in these contracts because they don't read it, they don't look at all the details, and they don't know or they're not confident enough to try to negotiate these contracts. So you really need to know your worth as a provider and negotiate these contracts. The next thing I wish I would have known as a provider is that more money, more problems. Okay, so everyone is just looking at this nurse practitioner stuff like, oh yeah, the glitz, the lights and all this, the glam. Oh, you're almost like a doctor, you're prescribing, you're treating, you're this and that. It just gets harder. Okay, it's more time consuming. It's a lot of more thought process going on. It increases the anxiety. You have to be on all of the time, and there's really no room for error, right? So more money, more problems. This can increase your stress levels. It can cause a lot of people to become depressed. It can cause a lot of people to become burned out. So you have to understand that this is not just something that is like, oh, okay, let me just go to work. These are people's lives. So you really have to be careful with what you're doing, and more money, more problems. So just because it's something that you see a lot of people doing, it's nothing to play with, and it comes with different pressures. So be ready for that. The next thing I wish I would have known is to trust no one. Okay, trust no one. And that's especially if you're working in a practice, albeit a small practice, because the thing is, a lot of times with a lot of these practices, it's a lot of cliques. It's a lot of people who may not like the fact that you are a provider, and they may talk about you. They may start stuff. They may say, oh, you're not doing this. They may try to tell on you. They may try to start gossip about you that isn't true. Trust no one. The main thing you have to do when you go into these job spaces as far as a provider is to do no harm, to treat your patients, and to be as professional as possible. I would not suggest trying to be friends with anyone or anything like that. Of course, get along with everyone, treat everyone with respect, and have the appropriate decorum at the job. But these places, as a provider, as a nurse practitioner, PA, are not places that you need to be making friends. Now, the thing is, you can make friends in every space, right? Every workspace that you go, you can probably find maybe 1 or 2 people that might be genuine and that you can be friends with. But I would suggest not trusting anyone, not becoming friends with anyone. You can be social, you can talk, you know, small talk, office things, but don't say anything to anyone that you would not want to get back to anyone in the workspace or anything like that. And try not to give too much information that can come back and bite you on the butt. So I would say trust no one. The next thing I would say, as far as if you're working at a small practice, is you have to be aware that a lot of these practices, it circulates around the doctor. Say, for instance, if it's a private practice owned by one specific doctor, or maybe like partners, a lot of times the nurse practitioners and the PAs are not the number ones that they think about. It revolves around the provider, what the provider wants to do, the goals that the provider has, the provider's schedules, the provider's comfortability, or the doctor is what I mean, their comfortability. So it's not always about the nurse practitioner. So a lot of times the nurse practitioner comes in second or third, right? For example, if it's a smaller practice, if you might need to have a doctor's appointment, might need to have, something, might need to do something during the week, during the hours of 9 to 5, you may not be able to get time off. You may have to like push your stuff and work around that practice's schedule and not have your specific time for yourself. So you really have to think about those things as far as, your the quality of life that you want to pursue with a lot of these different jobs. Another thing is trying to avoid provider burnout, right? I touched on it a little bit prior when I said that a lot of times you may not be able to get a break. My last position, I worked both hospital and I worked both clinic. So it's half a day hospital, half a day clinic. So it was basically busy throughout. And once I left the position, I had so much provider burnout to the point where I was thinking like, do I really want to do this? Like, is this something that I really want to do? So with a lot of these positions, I would suggest, if you do work as a provider, that you do either clinic or you do hospital. Now, there are plenty other positions that nurse practitioners can work outside of the clinic or the hospital, but those are the 2 primary ones. So if you choose to do both, you just have to know that it's very rigorous. It comes with a lot, and you really, really need to know how to manage your time, organize your time, and to come up with methods as far as how to do self-care, how to avoid provider burnout and things of that nature. So that's definitely one of the biggest things that providers need to try to avoid, is provider burnout, because it comes a lot, especially, coming off of the heels of COVID. And a lot of the newer nurse practitioners, they went through COVID as RNs, and they came in as, with me, I came into the NP world in around 2021. So COVID was still around, and, we went through the spikes and stuff like that. So it's really, the nurse practitioner world is something that's really, really expanding. It's growing, but a lot of people don't really know what to expect when they first get into it. And a lot of times it can cause people can have really terrible experiences with their first job because of the fact that they don't know what to look for, and like different outlets that they have, or different things that is known to them. So one more thing that I want to throw out there is also to just, in whatever state you're in, look up your provider laws, your scope of practice laws. Look up what that is for each state, so you'll be in the know, so you won't get taken advantage of. Because if the less you know, the more you can get taken advantage of. The more people can use your greenness, if they per se, or your naivety against you. So that's another thing. Just always, become more educated with the laws. Make sure you have malpractice insurance, and make sure that, you read as much as you can. You know, of course, reach out to people up to date. I was fortunate enough to have a lot of physician friends who walked me through the steps, who told me, you know, about what occurred at their previous jobs, their mistakes and things like that. And in my opinion, one of the main things I say is to avoid private practices going in. I would suggest working at hospitals, doing home health, looking to try to see if you can do, you know, public health or something like that. But even if you do private practices, I would suggest a group, in a larger group, so you can have a lot of resources and you can have a lot of help. But, you know, that's my experience. In the event, you know, you all have any questions or you want to talk about it or anything that, you know, y'all may want to talk about, just drop in the comments. I'm really, you know, versatile. I answer whatever questions I have. I'm very helpful. If anybody needs any advice, any guidance or anything like that, just let me know. Thank y'all for watching. Come again.